And I think we all can agree that genomics and the role of biomarker testing is a really hot, complex topic and is really difficult to explain to patients and caregivers, especially dependent on their health literacy. Couple that then with the time that it takes for waiting for these, as we've heard time and time again, that's daunting when you've been told you've got a diagnosis of lung cancer and now your care team saying, and now you have to wait for a couple weeks till those results come in. The biggest thing is our messages need to be crystal clear. What is biomarker testing? You know, it's easy when I'm sitting with patients the first time they hear that we're testing their tumor for any mutations that may be causing their cancer to grow. Their first thought is am I going to pass this to my children? So they need to understand the difference between genomics as well as their genetics, but they also have to understand that lung cancer, as we know, is not a solid I mean, it's not one cancer. It's a multitude of cancers. And they'll hear talk in the news and everything else about precision medicine and personalized medicine. And what does that mean? And this is our time to actually explain to them that that's the reason we're testing your tumor. We want to know what's making it tick, what's making it grow. And by waiting and getting those results back before we start you on a treatment plan will actually give you then the best first available treatment. I mean, as we're sitting there and patients come to us for second opinions, they're seeking clarification and confirmation that what they've been told from their prior medical oncologist is true. They have to wait for these answers. And it's during those interactions that we also, as a healthcare team, need to start listening for subtle clues that's causing them to have sleepless nights and recognize those concerns and then provide them the ongoing, reiteration of the importance of following each of the steps in a methodical way in the best answer and get them into a treatment plan quickly. And the more as the healthcare team, the members of the thoracic team can kind of talk through what biomarker testing is and be able to communicate that with the patients along the trajectory, the more the patients will be able to normalize this process and in turn lessen their distress.